Assalamualaikum. In this video I'm going to share how to set your ventilator settings. So the first thing over here is this volume control synchronized intermittent mandatory ventilation. This is the ventilator from company Drager. Okay, so these are the graphs, and these are the settings which we have set over here, and these are the values of the patient, right? We will set these things, and what are the actual values of the patient, they will be shown along this line, right? So how we can change our settings? So the first thing is I'm going to click on the ventilation settings, and you have to use your nail, right? Okay, so now you can see certain things. There are different modes. For example, there is AC mode or CMV mode, that is continuous mandatory ventilation, and then we have the SIMV mode. We normally use SIMV mode here, and then we have this CPAP mode. In most of the other vents of this ICU, we have the BiPAP settings over here. So currently I'm talking about SIMV mode. So here is the FiO2, so I'm going to click it with my nail, and by increasing this knob like this, I can increase it. Like for example, I want to keep it at 50%, so that would be my FiO2. And then if I want to set my tidal volumes, I'm going to click it, and by turning the knob I can reduce it. So let's say I want to keep it at 450, and this always does 1.2 in all the ventilators that we have here. So obviously the anesthetist would tell it better, but as we are running this medical ICU and I'm a trainee over here, so I'm not very sure about all of these things, right? Okay, so this ventilator is actually having some issues, so it has gone back to its original tidal volume due to some apnea setting sort of thing. Okay, so we are going to talk about the respiratory rate now. Let's say I'm going to increase it to 18. So by again turning the knob and pressing it, it's set. If I want to increase the PEEP, I will again do it, and let's say I want to keep it at 10, right? Okay, if I want to increase the saturation of the patient, and if I want to treat the type 1 respiratory failure, I will increase the FiO2. Let's say I'm going to take it to 100%, right? And along with that, to treat type 1 respiratory failure, I have to increase the PEEP, which I have already increased, but you can take it up to 20, right? But these two things will increase the oxygen saturation of the patient. But if we want to treat the type 2 respiratory failure, then I would increase his tidal volume. That I cannot increase a lot because it can cause barotrauma, so 500 is enough. And then I would increase or increase his respiratory rate, because the minute ventilation, if it increases, the CO2 washout will increase. So let's say I'm taking it to 20, right? So if we control the tidal volume and respiratory rate, we can treat type 2 respiratory failure. But if we control the FiO2 or increase it and increase the PEEP, then it will treat our type 1 respiratory failure. But the thing with PEEP is that if you increase it way too much, it decreases the preload, and that means that if the preload is less, so the blood pressure will decrease. So by increasing the PEEP, your blood pressure decreases. It's very good if the patient is in pulmonary edema with normal blood pressure, but if the patient is in shock, then you are not supposed to increase the PEEP way too much, because it will decrease the blood pressure. So for the patients who are in shock, we reduce the PEEP to 3, right? So now I'm gonna set these settings back to the original settings. My FiO2 was 35%. So I'm going to take it to 35%. I'm done. Okay, now tidal volume was 500, so that's okay. Respiratory rate was around 17, so I have to press the knob, and then my PEEP was 5. So that's how you can use a ventilator in ICU, even if you are not a resident of anesthesia or whatever. So in medical ICUs or in emergency ventilators, we are the ones who have to do these settings, so we are supposed to know. Okay, If the patient saturation starts getting better and the original indication for which he was ventilated has improved, we will start decreasing his FiO2. And if the patient is maintaining saturation at 30 to 21% of FiO2, then we will give him weaning trial. If he can cough out his secretions and if he is following the command, whatever. Okay, if these things are all right, then we will start moving towards weaning off. And for weaning off, we can give a trial of CPAP. So I want to show you what are the settings over here. Here we only control the FiO2 and PEEP, and then we give some pressure support, right? So if the patient tolerates CPAP for 2 hours or 1 hour, then we will again give him a trial of SIMV, and then we will again give him a trial of CPAP. And if the patient tolerates that well, can cough out his secretions, and for the original indication for which he was ventilated has been cured, and patient is conscious and following the command, and can cough out his secretions, that is actually very important, then you can extubate the patient, right? So these are some of the major ventilator settings. I hope you have learned something today. Have a good day. Thank you so much for watching the video.